So this is Trevor, and you're for South Africa. Where in South Africa?
Durban.
Durban. Okay, and
It's on the east coast.
east coast of South Africa. All right.
Yeah,
Um, and so one of the things is you're like 67, right? 66, 67.
that's right.
Okay. And I was going through the notes before this call, and you've been suffering with prostatitis since your 30s. Is that right?
That's correct.
Okay.
Yes.
So we're talking 3 decades.
Yeah.
30 years Trevor's been suffering with prostatitis.
Enough.
No, okay.
Because of the all the fluoroquinolone antibiotics the doctors and neurologists gave me, I've now got fluoroquinolone toxicity.
Yeah. How many rounds of antibiotics would this is just kind of your guesstimation that you've been on since
Wow.
30 years?
20, 30. I've also had two IVs when I had when I had a biopsy of the prostate, and another one when I had the TURP, the resection of the urethra, all around the prostate, around the urethra.
So you
And
actually
then
had surgery for your prostatitis then, Trevor?
it wasn't for the prostatitis, it was for the prostate's enlarged. And then obviously they take cultures of it and then take a biopsy, and then there was no cancer, but they found prostatitis in the bits that they cut out or sucked out, whatever they do. I'm not sure.
Yeah, right.
Um, yeah, I mean, I've been sleeping with quite a large cushion between my legs to keep my legs up
Yeah.
spread, so otherwise the pressure sore on the prostate. Um,
Yeah, just so people
so,
understand. So your prostate
mm,
was so enlarged that when you'd sleep on your side, you couldn't sleep on your side without a pillow between your legs because just with the
yeah,
legs being bent like this, it would
mm,
squeeze the prostate. Is that right?
that's correct.
Yeah,
Yes.
that's shocking. And how much pain was there, like when this would happen?
Look, it's quite a lot of pain. It's very uncomfortable,
Hmm.
and well, I don't sit much because of the other tendon problems I've got. But when I do drive, then it's also, if you're in a flare up, it's very sore when you finish driving. So yeah, it's a lot of pain. I'd go for a walk sometimes. It sort of eases it a bit.
Hmm.
Slow walk.
Hmm.
You don't want to be standing in one spot or laying down when you're having a severe attack
Yeah.
or severe inflammation.
And how much better would you say it is now since we've done since we've gone through a functional medicine program?
Yeah, I would say it must be about 90% better.
90% better. Okay.
Mm,
Wow, that's awesome.
yeah.
Yeah, it's great. And then, so 30 years of prostatitis, 90% better. And we started, just to give people a reference, around June 6th. So June 6th, and now it's December. So what we're talking 6 months, and you suffer with prostatitis for 30 years, and within 6 months, it's 90% better.
Yes, that's correct.
Okay.
Mm.
All right. That's awesome. Congratulations, man. That's exciting, like,
Yeah, no, it's a big milestone for me, that's for sure.
yeah. And then also too, you were talking about some other things I had written down here. So the prostate is obviously huge. Have you been able to decrease any of your medications or any medications that you were on?
Yeah, I can sometimes go a few days without it.
Without
Um,
what?
Without the medication that's more for the enlargement of it.
Mm-hmm.
It's nothing to do with prostatitis. Um, but it's an 8 milligram pill, so I'm hoping to, next time I'm due for a repeat, I'll get a 4 milligram and then try and phase it out.
Okay. So your medication for your prostate is in half? It's more than
Yeah,
half, six,
I'd say it's about half now.
half there. Okay, nice. And then I
Mm.
think you're also on like some hypertension medication, blood pressure medication.
Yeah, I was on two different medications. One was a calcium blocker, the water pill. The other one was a normal 300 milligram. It's called Herbowin.
Mm,
Um, so now, yeah, all of a sudden my blood pressure dropped quite low.
right.
So
So
I've
then are you
I've
off
been
those?
I've been the one I'm off, the other one I've been breaking in half.
Ah, geez.
Uh,
Okay.
so actually, some days I don't even take it,
Yeah.
and then
Okay.
I check and I say, okay, it's gone up a little bit again, but
Ah.
you know my lower what's the lower one? The systolic. Um,
So you were on two blood pressure medications. Now basically you're taking one half capsule like every
of
other
the one,
day,
yeah,
every third day,
yeah. Let's say every other day.
every other day.
Um,
All right, that's substantial.
yeah,
Wow. Okay. And then you're saying sometimes your blood pressure is goes too low now?
yeah. It's going into the lower figures, going into the 70s.
Ah, okay. Yeah. I mean, that's what's go
From
ahead.
being over 100. You know.
Yeah, that's great. I mean, that's just telling you like your all this inflammation that was wrapped up in your body has been really decreased
Yeah.
a lot. Um, maybe just kind of tell the audience because I mean, there's gonna be a lot of men that are gonna be interested in their prostate and prostatitis.
Mm.
Um, a couple things that we did is before I go to that, your gut. You said your gut's a lot better, right?
Oh yes, yes.
Tell them about your gut.
It
Like,
is a
how
lot.
bad was your gut before?
Well, my gut was bad. I had like almost permanent diarrhea,
Mm.
and sometimes it would get really bad, you know. And I didn't smell too pleasant either when I had bad diarrhea. Um, and then I started on that. Well, I had a combination, depend what I could get. Was the vital nutrients, GR, gut repair, and
Yeah.
then the Amy Myers
Yeah.
equivalent.
Yeah.
So, and then also I cut out wheat altogether. That helped a lot. Or
You
combination of it helped. Yeah.
yeah. Yeah. We changed your diet quite a bit. So you started taking some like gut
Yes.
repair stuff and you cleaned up your
Mm,
diet.
yeah.
Yeah.
So there's I think a big improvement in my gut.
So just kind of give the audience, whoever's gonna be listening to this, could be anywhere.
Mm.
Like so you went from like constant diarrhea to what is it now?
I'd say it's very close to normal now.
Wow. Okay.
I have the little odd. It's not diarrhea, just a bit of quite loose stools. But it's you know it's not the norm. It's rare.
Yeah. Okay. Yeah. Great. That's
So
awesome.
mm,
Yeah. And I think a couple, when you first came out, I think we did many, many different things. I don't know. We probably did, I don't know, 15, 20 different things. But one of the two things I think were critical. Well, there's a lot of things that are critical. It's not one thing, but some
mm,
innovative things that we were doing in your case, which was one, we started doing methylene blue,
yes,
right? And then we did red light therapy. So you would take the methylene blue and
and
then
half an
30,
hour
30
later.
go
Mm,
ahead.
yeah, half an hour, 30 minutes after that, I'd use the red light on the area in question.
Yeah, right. Right. So, I mean, this is yeah, I don't want people to just to see this video and say, "Oh, I'm going to go out and take some methylene blue and red light therapy and your prostatitis is going to go away." That's not what's going to happen. But I think the
Mm,
combination with all the different components that we were doing um and then doing the red light therapy or taking this is critical. You got to take the methylene blue and then 30 minutes later you do the red light therapy because the methylene blue gets in the mitochondria and then that red light therapy can absorb um, the mitochondria, because it has a methylene blue, the red light is absorbed in that blue kind of like dye, and then that helps your mitochondria to
Mm,
function better. And if someone has prostatitis for a man or urinary tract infections for a woman, the principle is
mm.
kind of the same. It gets in there and just helps heal the whole digestive tract or the prostatitis or whatever organ we're talking about. Yeah. So since you've been feeling better, a couple other things too, like you had some brain fog and those kind of things. Has that improved on you, Trevor?
I think it has improved slightly.
Mm-hmm.
Um, I think I can remember things a bit better now, taking that magnesium L-threonate.
Oh,
That
yeah, yeah.
the what's it? Life Extension is the name
Yep.
of the brand.
Yep.
Mm.
Right. Yep. Are you taking the
And then
capsules or the powder on that?
capsules.
Capsules. Okay.
And then for my gut, I'm also taking that butyrate.
Oh, yeah, yeah.
Yeah, I forgot about that.
Yep. That's gut and brain. I mean, there's so many different things that we've done with
Mm,
you over
yeah.
6 months. And you've been really diligent. And hell, you're in South Africa and you were still able to get these products. Somehow you got them delivered
Well,
to you.
that's actually my last delivery went missing.
Oh, went missing.
Uh, yeah, fortunately, Amazon refunded me.
Okay.
So now, well, I've still got a few months worth, but um, yeah, unfortunately, our customs and things don't work too well. So
Yeah. You got to be
um,
3 months
it's like
ahead of the curve in case a package gets lost,
yeah,
huh?
at least 3 months.
Okay. All right. All right. Well, excellent. That's great. Were you still doing the chi machine at all? Did you get that? What's your kind of, is
Yeah,
there anything you want
I
to say
did.
about the chi machine and that kind of thing here?
Yeah, well, I can basically only use my one leg on it because of the other one because of that hamstring that was repaired. Um, but I think it does help to get oxygen flowing. It does seem to help.
Mm-hmm.
And that and going for a slow walk, I
Yeah.
think helps to get the oxygen,
Go on.
to all the parts of the body.
Yeah. So if there's anyone watching this, what do you want to tell? What would your advice be for some fella who's sitting with prostatitis, uh, and going through like a program like this?
Oh, I could. First thing I'd like to say is don't take fluoroquinolone antibiotics because if you have a reaction to them like me and thousands, maybe millions of others, it
Millions.
just destroys your life.
Yeah.
Choose a natural way to like similar, to this to try and sort it out because the antibiotics didn't help anyway. But because I was clueless at that stage, you just trusted in the doctors and big pharma. You thought they were on your side, but they're not. Um,
Yeah.
so there are alternative methods. There are probably more than the one we're doing, but I think that's the way to go. It's worked
Yeah.
for me, so it should work for a lot of other people.
Yep, yep, for sure. And one thing, if I'm located in the United States in Minnesota, and you're in the eastern part of South Africa. So if you're watching this video, like no matter where you are on planet Earth, like you can get help. Like there's Zoom calls, there's Amazon that now can deliver pretty much at any space of the globe.
Mm.
Like you can get better. There's no reason for you to suffer. You just have to reach out and ask for some help. Okay, so any kind of last remarks here before we end the recording here, Trevor, that you want to tell me or anyone that may be watching this?
Um, I don't think so. It's just never give up. Don't get despondent. There is help. Keep looking. You'll find it.
Yeah. I think that you brought up a good point there. I think a lot of times when I only see people only come to me if they're like really not doing well, right? I mean, I don't see easy
Yeah.
cases. All the cases I see are
Mm.
extreme
Oh,
difficult case. Like you've been suffering for 30 years with
mm.
prostatitis. I mean, it's a long time to be suffering. So the cases that I see are all difficult cases. And I think one thing is like you just mentioned is like just focusing on just like not getting down and your headspace has to be right. Like, yeah, you can recover, you can recover, you can get better, you can get better. And I think when it comes to like chronicity and long chronic conditions, that can be very hard mentally on people. And what I've noticed clinically, if people feel like what you felt, like you don't give up and there's an answer, the probability of them getting better is much greater than someone that's kind of like checked out already and they're just kind of like, oh, I'm just going to live with this chronic kind of condition.
Yeah, and in my case, it became sort of impossible to live with it, so I had to, keep looking.